Hi, I'm Urinalysis and I'll be demonstrating a urinalysis. So I'm going to start off by writing the patient's name on the urinalysis record. And I'll also be writing the method of collection of the urine and today's date. And the time of urine collection. And when I'm done with that, I will start a visual inspection of the urine sample. So I'll look into the pee, and this pee is more dark yellow, so I would write that on the patient's record. And I'll also be checking for clarity or turbidity, which means how cloudy or clear the pee is. And this urine sample is slightly turbid. And the last thing for the visual inspection is odor, so I'll have to smell the urine sample. And this is a strong odor. So next, I will pull out this refractometer and determine specific gravity. So using a pipette, I'll collect a drop of urine and place it on the refractometer. And I will dispose of this pipette after I'm finished. And I will look into the light, and I'll read the right-hand side under where it says UG. And the specific gravity is 1024. So I will write that on the patient's record. And when I'm done with that, I will go over to the sink and wash this off the refractometer. And using Kim wipes, I will clean this off. And I'll put this back into its case. So the next step is using chemical assay strips. I will place a drop of pee onto each square and then follow the directions on this bottle. So I'll close this off so all the rest of the strips stay fresh. And I will collect urine with a pipette and add a drop onto each square. And then I will dispose of this pipette after it's done being used. So this bottle indicates to wait after 30 seconds to start determining the glucose and bilirubin. So I'm going to wait those 30 seconds.
Okay, well, we're gonna cut this out.
So after the 30 seconds are over, I will read glucose and find the matching color to it. And right here, it matches negative. So on the patient's record, I will write negative after glucose. For bilirubin, it reads as negative as well. So I will be writing that on the patient's record. After 40 seconds pass, I'll read ketone, and that also reads as negative. This chemical assay strip bottle has specific gravity, but I already read that through the refractometer, so I'll skip that. And I'll go on to blood. After 60 seconds, it reads as negative as well. So the next one is pH, and that one would be around 6.5. For protein, that matches negative. For urobilinogen, that matches normal. For nitrite, it also matches negative, and for leukocytes, it matches negative. So once I'm done reading the chemical assay strips, I will dispose of it. Okay. And the next step for this urinalysis will be to add pee into the, cut that, I'm sorry, I keep saying pee. Okay, so the next step will be to add a urine sample into the test tube with tapered ends, also known as conical tubes. So I will collect this urine with a pipette. So taking my conical tube and pipette, I will add urine up until this line right here. So I'll dispose of this pipette, and I will take another conical tube with the same amount of water so I can balance it out in the centrifuge. So once I'm done with that, I will close my urine sample, and I will take these two conical tubes into the centrifuge. And I will be placing these two conical tubes right across from each other so they can be balanced. And we add this, not too tight, so I can get it off when it's done. So I close this, and I will be doing low, and then the lowest speed as well, for 10 minutes. And then we wait for the centrifuge to be over. Okay, so after the 10 minutes are done, I will take my conical tubes out and put them onto my test tube rack, and I will take this off and remove this and close this back up, and I'm going to turn this off. So coming back over, step will be to do decant on the urine sample. So I'm going to come over to the sink, and I will do a quick motion. Okay, so once I'm done with this, I'm going to come back here, and I'm going to add the urine sediment stain into my urine sample. So all I need is one drop. Okay, so I'm going to close this back. So I'll kind of flick this so it can mix in there. And once that's mixed and done, I will add a drop of it onto this microscope slide, and before doing that, I'll have to have the patient's name on it, so when the vet tech is examining it, she can know whose this urine sample is. So using my pipette, I will grab the urine sample and add a drop of it. and I will dispose of this. And then I will grab my plastic cover slip and I will put it on top of this stain. Okay. And once I'm done with this, I will take the patient's urinalysis record and its microscope slide and put it right next to the microscope for the veterinary technician or the veterinarian to examine it. And this is how you do a urinalysis.